Hi everyone, my name is Tay King. I'm from Montmell State Community College, and my presentation is on acute hepatitis B. The case study I'm going to be presenting is on a 79-year-old woman who was diagnosed with acute hepatitis B. This woman had previously been diagnosed with Graves' disease and was on medication for it. Upon admission, her thyroid levels were normal, and she also had a history of acupuncture for back pain. On a regular checkup for Graves' disease, her lab results came back with a severe increase in liver enzymes about 2 months before admission, and the follow-up results caused her to be admitted to the hospital. The only symptom that she presented with was fatigue. She had many significant lab results. Her AST, ALT, LDH, and ALP all indicate liver damage. Her total bilirubin and direct bilirubin also indicate that the liver was not functioning properly. These biochemical results prompted the physician to order tests for hepatitis B. The serology results are as follows: hepatitis B surface antigen positive, hepatitis B core antibody positive, envelope antigen positive, envelope antibody negative, HBV DNA positive, and IgM core antibody positive. They also tested for IgA and IgM for hepatitis E antibody, and they were both negative, and they tested for hepatitis C antibody, and it was negative. Liver enzymes are very important when screening for hepatitis B. The most commonly tested enzymes are AST, ALT, ALP, LDH, and GGT. When liver enzymes are above normal range, it can mean that there is damage occurring in the liver. While these specific enzymes are most common when evaluating the liver, they are also in other parts of the body as well. AST is mostly in the liver and the heart, and a little in the muscle. ALT is mostly in the liver and small amount in the heart and muscle. ALP is mostly in the liver, bile duct, with some in the bone, intestines, and kidneys. LDH is in almost all of the body cells, especially the heart, the liver, and the red blood cells. And finally, GGT is mostly in the liver and associated with alcoholism. ALT is the most closely monitored for liver function because it is almost exclusively in liver cells. AST is normally tested along with ALT to assess liver damage, but it can also assess the kidneys, heart, or pancreas. The ALP enzyme is found in high levels if there is biliary tract obstruction or lesions, and this can happen in hepatocellular carcinoma or in trauma. Certain ranges of enzymes can indicate severity of liver damage. This chart indicates the different levels of severity of liver damage when compared to enzyme levels. AST normal range is 5 to 45 international units per liter. Abnormal mild is 40 to 300, and abnormal severe is greater than 300. ALT is 29 to 33, normal. Abnormal mild is 40 to 200, and abnormal severe is greater than 200. ALP normal range is less than 112, abnormal mild is 112 to 300, and abnormal severe is greater than 300. Normal GGT is 0 to 30, abnormal mild is 60 to 200, and abnormal severe is greater than 200. The normal range for LDH or LD is 105 to 133 international units per liter. In this specific case study, all the enzymes values given indicate severe liver damage. AST was 1,000, 134, ALT was 804, ALP was 494, and LDH was 592. Serology tests. Serology tests for Hep B markers are the most important tool for diagnosing hepatitis B. The markers can aid the physician in understanding how severe the infection is, if they are developing the proper immune response, and if it is a chronic or acute infection. These tests are usually performed by enzyme-linked immunosorbent assay, or ELISA. This is where an antibody to a certain antigen or antibody is labeled with an enzyme, which, when bound to its target, will produce a colorimetric reaction, which is measured and resulted. Each serologic marker can mean something different when relating to the phase of the disease. Serologic markers. Hepatitis surface antigen is normally the first detectable marker of an infection. Antibody to Hep B surface antigen is present when someone recovers from an infection or is given the hepatitis B virus vaccine. Antibody to Hep B core antigen will appear when someone starts to experience symptoms due to hepatitis B and will be continually present throughout their lifetime. Hepatitis B envelope antigen is only present during an infection, and antibody to envelope antigen indicates a sudden increase in viral antigen. An important indicator of acute hepatitis is the presence of IgM, anti-HBC, and hepatitis surface antigen without any of the antibody towards the surface antigen. This is helpful in differentiating between acute and chronic infections. A sudden increase in hepatitis envelope antibody is indicative of an effective immune response and a quick recovery. This is a chart showing the different serological results throughout an infection. As you can see, hepatitis B surface antigen is the first to present itself. Shortly after, anti-HBC or core antigen will also increase, and it will not decrease throughout infection and will persist throughout their lifetime. IgM, anti-HBC, is significant in acute infections, and it will not really be seen in chronic ones. Anti-hepatitis B surface antibody will increase when there is immunity and the virus is eradicated. If someone is vaccinated, anti-HBs will be present, but anti-HBC will not. Hepatitis B transmission. Hepatitis B is transmitted through the exchange of blood products and is usually an STD. Other possible ways of transmission include accidental needle sticks, dental care, acupuncture, and mother-to-fetus transmission. In our specific case study, the most probable route of transmission was the acupuncture she took for back pain for a year. Hepatitis symptoms. Diagnosis of hepatitis relies greatly on the lab because HBV symptoms are not very distinct. This specific case study is a good example because the patient's only symptom was fatigue. Generally, HBV-infected patients usually have flu-like symptoms. HBV vaccination. Hepatitis B can be prevented by vaccination. It is normally given in 3 doses. Normally, the first dose is given after birth. This has greatly aided in preventing the spread of hepatitis B. HBV genotypes. Hepatitis B virus genotypes are variations in the HBV gene. There are 10 known genotypes, and they are signified by capital letters A through J. Certain genotypes can indicate different levels of mortality, severity, and reoccurrence. Of each genotype, there is usually a specific area of the world that has a higher prevalence of that specific genotype. Genotype A. Genotype A is associated with higher chronicity, and it is more common in homosexual men. It's prevalent in North America, Northern Europe, and Central Africa. Genotype B can combine with genotype C, and they are indicated of increased risk in hepatocellular carcinoma. This genotype is commonly transmitted in Southeast Asia. Genotype B does not always combine with genotype C, but when it does, it is increased risk of hepatocellular carcinoma. Genotype C. Genotype C has high risk for hepatocellular carcinoma and liver cirrhosis. This specific genotype increases persistence of the HBe antigen, and it is harder to clear from the body. This is also associated with viral mutations and is common to Southeast Asia. Genotype D. This is the less severe form of hepatitis B. It's associated with quick formation of anti-HBe antibody, which would indicate a low viral load and a low chronicity. Genotype D is also more common in intravenous drug users and is prevalent in North America, Northern Europe, India, Africa, and the Mediterranean region. Case study genotype. In our specific case study, the genotype was determined to be a subgenotype of D1. Our patient received no antiviral medications and made a full recovery. According to the case study article, they state that to their knowledge, this is the first documented case of a hepatitis B infection with the subgenotype D1 in Japan. One may ask, why is this significant? This is because the woman had no family history of hepatitis B virus, and she did not have any sexual intercourse, which indicates that an unknowingly infected individual is traveling to Japan. Other significance of genotyping is some genotypes react differently with antiviral medication, so it helps the doctor to know how to best treat the patient. It is also helpful in understanding the migration of different genotypes from one area of the world to the other. If there is a genotype mutation that is not common in an area, it could be spread more readily due to a decrease in immunity. An increase in a genotype, such as C, that has a high chronicity, could mean an increase in hepatocellular carcinoma or liver cirrhosis in that area that wasn't present there previously. Acute hepatitis B treatment. Normally, acute hepatitis B is treated with plenty of fluids and rest, and not any specific medications. In severe cases of acute hepatitis B, they can be treated with antiviral drugs. These antiviral drugs work by inhibiting DNA replication of the virus inside the host cells. Most patients with acute Hep B will recover within 6 months without any specific treatment. Treatment of chronic HBV. People diagnosed with chronic HBV will most likely be on medication for their life. If they are not medicated or treated in some way, they will probably develop liver cirrhosis. Some treatments include antiviral medications, interferon injections, which are injections of substance made by human cells that fight infections and tumor cells. Another way of treatment is liver transplants. Some good news about this diagnosis is that many can live long, healthy lives with medication and healthy living. All case study information can be found in the journal Internal Medicine. The title of the article is "A 79-year-old woman with acute hepatitis B caused by the infection of a subgenotype D1 hepatitis B virus in Japan, a case study." Thank you for listening.